listen, we are going to begin with the latest on the Johnson & Johnson COVID vaccine, with the shot now under the microscope by the FDA and the CDC. Both agencies are reviewing cases of at least 6 Americans who developed serious blood clots after getting the single-dose vaccine. Here's the thing, around 7 million people in the U.S. have already received that vaccine. But all 50 states have stopped using the shot, at least for now. And there are growing concerns that this will exacerbate vaccine hesitancy. So Laura Podesta is following the latest for us. Laura, they're calling this a pause. So how long are officials expecting this pause to last?
Good morning, Anne-Marie. So the FDA has said it expects the pause to last from a few days to a week. But today, members of the FDA and the CDC will be having a meeting and will be holding an official vote to determine updated recommendations. Today, the CDC will hold an emergency meeting to discuss the blood clotting possibly associated with the Johnson & Johnson single-shot COVID vaccine. There are 6 reported cases of rare but severe blood clots. 1 woman has died and another is in critical condition.
It was alarming to me. I have a clotting history, so it definitely gave me some moments of terror.
Molly SCANNELL already received the Johnson & Johnson shot, and she's now concerned after hearing that the clots develop 6 to 13 days later.
Just to put my mind at ease, I emailed my cardiologist.
Dr. Anthony Fauci also trying to ease concerns by reminding the public just how rare the blood clots are.
There have been 6 out of the 6.85 million doses, which is less than 1 in a million.
Health experts worry this latest news will further vaccine hesitancy.
Less likely that you'd have this side effect from a Johnson & Johnson vaccine than being struck by lightning.
The White House insists the pace of vaccinations will not change much. 95% of the supply so far has come from Pfizer and Moderna.
There's enough vaccine that is basically 100% unquestionable for every single solitary American.
To try and make up for the gap caused by the Johnson & Johnson pause, Pfizer CEO yesterday announced the company would boost production and deliver 10% more doses to the U.S. by the end of May than previously agreed. And Johnson & Johnson has announced that it will proactively delay rollout in Europe, and it has paused all vaccinations in its clinical trials, Anne-Marie.
So, Laura, Dr. Anthony Fauci spoke to CBS Evening News anchor and managing editor Norah O'Donnell last night. What advice did he give people?
So he said if you had the Johnson & Johnson vaccine 4 weeks ago, you're absolutely fine. If you've had it more recently, there are several symptoms he wants you to look out for. That includes severe headache, difficulty breathing, difficulty with your movements, and any chest pressure. And we know that these 6 cases were all present in women, so it's women in particular who need to look out for these symptoms, Anne-Marie.
And Dr. Fauci and other top health officials also spoke to a handful of governors yesterday about the pause. What concerns were raised during that discussion?
Well, there was a lot of concern about vaccine hesitancy. Governor Andrew Cuomo of New York was one of the governors who said he doesn't know if there's going to be enough Moderna and Pfizer vaccines to make up for the people who decide after this, maybe I don't want that Johnson & Johnson vaccine. We also heard from some governors in more rural states, including Pete Ricketts of Nebraska, who said he is concerned for people who have to travel far in order to get their vaccines and who might not show up at those clinics, and the clinic may have already opened a vial, and that vial will go to waste.
Yeah, those are all valid concerns. Laura, thank you very much.